There's been a lot of press about the dangers to children's mental health from cell phone use that they use to access social media, especially in schools. According to the New York Times, these bans on cell phone use in school came as policymakers are searching for solutions to soaring rates of depression, anxiety, and self-harm among adolescents over the past 10 years. But did you know that there are also serious physical risks associated with gaming? Hello, I'm Deborah Quilter. I've written 2 books on repetitive strain injury. I'm very concerned about the risk of injury to children who play video games. According to a 2024 survey by the Pew Research Center, 85% of teens say they play video games, and about 4 in 10 do so daily. Many studies focus on the mental aspects of gaming, but repetitive strain injury, or RSI, due to gaming has also been documented. These injuries can have serious implications. Here's what every parent needs to know about the risks that children face. RSI, which is also referred to as overuse injuries, occurs from repeated motions, especially those that use a lot of force, such as pressing buttons with too much force or gripping controllers tightly. Children do this when they are caught up in the moment and excited about the game. These repetitive movements and the static posture of sitting for hours on end strain the thumbs, the wrists, the elbows, shoulders, and spine. Many people assume an ergonomic setup will prevent or cure RSI, but that's not true. While it is important to have the play or workstation set up to reduce strain, ergonomic adjustments or equipment alone doesn't address all the potential risk factors. Your ergonomic chair can't maintain good posture for you. In fact, the backrest leads to poor posture and muscle weakness because it encourages forward head posture. Your ergonomic keyboard can't overcome poor technique, such as using too much force or bending or twisting your wrist. The games are designed to be exciting, so very often children blow past breaks, which allow tissues to recover from overwork. Plus, no amount of ergonomics will overcome the sheer number of hours that gamers spend playing. Some studies recommend that children game for no more than 2 or 3 hours per day, but that number doesn't include the amount of time they are using computers and phones, which also add to the cumulative amount of overuse and strain on their body. Repetitive strain injury occurs gradually, and it's easy to shrug off the symptoms or be so preoccupied with playing that you ignore them because you're so focused on the game. Over time, these injuries can lead to significant pain and discomfort, which, if not addressed immediately, can lead to chronic injury. In the beginning, RSI is episodic. That means that children will have one episode that goes away. They'll think they're fine. But then a few weeks or months later, they'll have another episode. Then the episodes start happening closer and closer together until the person is chronically injured. When that happens, pain and other symptoms are no longer limited to playing video games. Even simple activities such as squeezing a tube of toothpaste, dressing, or lifting things could become difficult. Early intervention is extremely important. The signs of RSI are very subtle in the beginning. It could be just a feeling of fatigue or heaviness, or there could be numbness and tingling, or maybe your child is dropping things or very clumsy. An outward sign of RSI that are red flags would be if your child is shaking out his hands or massaging his wrists or elbow or neck or waking up in the middle of the night with numb hands. If your child complains about these signs or shows it in their behavior, take them to their doctor. Now, it might be difficult to find a doctor who's qualified to diagnose and treat repetitive strain injury, but keep looking. Many physicians are not up to speed on how to help people with RSI. And remember, treatments are not cures. Some of them actually make RSI worse. So if your doctor prescribes things like splints, other than short-term nighttime splinting for carpal tunnel syndrome, cortisone injections, or surgery, seek another opinion. Certain kinds of physical therapy can be helpful, and many people are in physical therapy for years just to maintain what hand function they still have. Prevention is the only cure for RSI. The best outcome is not to allow your children to play these games, unless they can strictly limit their use to less than an hour or even less a day, which may not be a reasonable goal because these games are designed to be addictive and keep children playing. Many children become extremely agitated when they're forced to stop. Children should be encouraged to take regular breaks from any computer or phone use, sit in good posture, and exercise regularly. This can significantly reduce the risk of injury. If your child starts this habit early on, you'll set them up for a healthier, hopefully injury-free future. All of these guidelines apply to other computer and technology use as well. Repetitive strain injury affects your whole life. Eventually, people experience symptoms beyond the situation that got them into trouble in the first place, such as playing games. Now they have trouble with simple activities such as dressing, shampooing their hair, opening doors, and a multitude of other common activities, in addition to having sometimes excruciating chronic pain. Repetitive strain injury can result in permanent disability. It's extremely difficult to find a job that doesn't require normal hand use. Who will support these children as adults? And what kind of life can they expect if they are disabled and living in chronic pain? To avoid this outcome, parents need to take repetitive strain injury seriously and strictly limit their child's gaming and phone and computer use. Please share this video to help other parents protect their children too. Remember, prevention starts with awareness. Share this video with your school board and other parents. And be sure to watch the video that's coming up next or linked in the details below for more important information about repetitive strain injury.